think to me, health means having an overall sense of well-being in all the facets of your life. So it's not just about being sick or not sick. It's about feeling happy and comfortable in your environment as well. Things like education, safe housing. So health really, to me, encompasses everything, and it's external and it's also internal.
Are you able to access education? Are you able to get fresh food, healthy food? Are you able to feel safe in a neighborhood where you can get exercise? Do you feel that you're culturally respected? You're in a place where you can state your opinions, you're not feeling disenfranchised.
What you eat or how much exercise you get, it's also where you live and how many choices you have in your life.
When we talk about systems and structural racism, those are really the things that I think about when we talk about impacting health, not just healthcare, but really the things that influence our everyday lives and our built environment.
The system is every piece of the society that we have, or the infrastructure that we have created as a society that touches you on a daily or weekly or monthly or even just once in your lifetime basis.
One way that the system has been flawed over the years is that it was designed, developed, and maintained by dominant society citizens.
What is the impact the decisions they are making every day is having on the entire community? The social conditions are determining the access you have to make healthy choices or not. We are one of the states with the worst inequities in health.
It's about income, it's about race, it's about where we live. Families are getting broken apart, people are living in fear, and you don't think that affects people's health and mental stability.
I see a lot of issues, in certain neighborhoods with access to healthy food. So we make a lot of this about, people not choosing certain things, but the reality is that people don't have the options to choose from that they should in order to make healthy choices.
Now, supposedly we're one of the healthiest states in this nation with best access to healthcare, yet because of the systems that we live in, our communities of color have experienced some of the highest health inequities in this country. Mainstream culture, the dominant systems are going to have to take a back seat.
Systems need to look more like our community. We need more people of color and American Indians in positions of power.
We can't solve the problem with the same system that created it.
When the system already has defined what health should look like, and it doesn't fit with particular individual or community's idea of what they want for themselves, that's already a tension that you have right there.
One of the best ways to partner with the community is to really start by immersing yourself in the community. A healthy community is a happy community.
When you see a person, treat that person as an individual who has specific needs and specific cultural needs and specific background. So understanding that builds a better connection and actually will help that individual.
I think there's some grassroots effort that must take place within our communities and then within ourselves.
I think we really have to come together as a community and create these healthy spaces.
If we're going to have a more compassionate, thoughtful society, then health and welfare and well-being and equity across racial and ethnic lines is imperative.
A healthy community is one wherein the people that live within that community have control over what happens within it.
There might be a scenario by which everyone is not benefiting equally from the system how it's designed.
Health is so much more than what happens inside the doctor's office. It is so much more than maybe what happens when you're at work. It's a culmination of all the pieces of life.
To envision a healthy community, I think, is one in which everybody feels like they're they're having a say in how they achieve the goals that they want to achieve, and they're having a say in defining what those goals are.